name is Pauline Long, and I am the social media and communication coordinator for Sisters Saving Ourselves Now. We're here at the Black Women's Economic and Health Symposium, and we are talking about improving the economics and advocacy efforts of Black women in Pittsburgh, especially since the report came out over the last couple of years. The research says that Pittsburgh was one of the worst places for Black women to live in America. And I'm here with Miss McDonough. McDonough, I'm sorry.
Okay.
Please introduce yourself.
Yeah. Hi, my name is Kathleen McDonough, but everyone calls me Mickey. And I'm here representing a new organization called Community and Family Builders. That is an advocacy organization also interested in providing support for populations that need it. The organization right now is doing a mentoring program in Penn Hills and Woodland Hills High School, has done workshops on manhood and sisterhood, and is really interested right now in generating interest among the Black community for Alzheimer's outreach and education.
All right. I'm so glad to hear that. And I'm glad you're here as one of our vendors, information vendors, passing out information about all the different programs that are working together in partnership with one another to improve the lives of Black women and men here in the Pittsburgh area. After what you've heard so far, we're only halfway through our program. Could you tell me what you feel is one or two of the most important things that you've heard so far?
All of them have been awesome. The presentation on social determinants of health and also the presentation on mental health were the most important to me. I think we've always felt like our health depended on our doctors. When we know better now, we know our health sometimes depends on our zip code and what resources are available in our communities and whether or not we've been exposed to trauma. So there's a lot more that goes into how healthy we are than how good our doctor is. And I think it's really important to recognize that a lot of the social determinants of health require advocacy. Because poor health, like I said, often depends on the neighborhood that you live in. So our job really needs to be to help make those neighborhoods healthy neighborhoods, and then the people who live in them will be healthier.
And I'm glad that you picked that subject of trauma and mental health because you're working with youth in the high schools, as you said, to mentor them. And one of the things that the presenter said about that was how there was a 10-point, I think it was the woman from Seton Hill. It was the 10-point test that they gave you to see how much a child or a person had been affected by, their mental health had been affected by these different things in the community, like how much trauma has affected them. And you will find that instead of there being like maybe 6 or 7 things, there may have been maybe 10 or 11. Mm-hmm. And that we have to deal with those things. And she said, I believe, that she would advocate that you see a therapist. Mm-hmm. What do you feel about, and also if it's a family generational kind of thing, that it should be family therapy?
Yeah.
How do you feel about that? I mean, it's always, I'm glad that I have you here, and I don't want to put you on the spot, but it's always been an issue that white people will go to a therapist, but Black people won't. So how do you think we can address that?
I think there's a stigma in the United States of America generally about getting help, because I think we're a system that's built on individualism and pull yourself up by the bootstraps, and that's impossible. You can't do that by yourself, right? But yet that's what we've been taught, regardless of what color we are, I think. I think what you're saying is that the stigma is stronger in the Black community, and I think that's for good reason. I think people of color are much more hesitant to seek traditional mental health help, because for centuries there's been a misinterpretation of presenting symptoms, and there's been a tendency in the system out there to attribute mental illness to Black patients when Black patients aren't mentally ill. They're suffering from trauma, or they're culturally, there's a lack of understanding, perhaps, I guess. But I do think it's really important, and I think the young woman who is a therapist is probably trained in trauma, because so often that is the root of a lot of presenting mental health issues, for sure.
Well, one thing that Pittsburgh Mon Valley Black Women's Roundtable has done is we've created a database on our website of several Black female therapists that are in the Pittsburgh area, because sometimes we feel better talking to someone who looks like us, that feel like they've had experiences of us, and
Sure.
they can relate to us. So one last question I'd like to ask you, may I call you Mickey?
You please,
Mickey,
yes.
is you're already involved, but based on some of the things you've heard today about housing and other things, what more do you think that you will do now that will help to improve
Yeah.
the lives of Black women in Pittsburgh?
One thing I forgot to mention was, separate from my helping my friend who started Community and Family Builders, is I'm also very active in Moms Demand Action, which is a gun violence prevention organization. And I think we know that the impact of gun violence, in spite of the fact that mass shootings get all the attention, that really the impact of gun violence is more likely to be seen in Black communities. So, I should have pointed that out early. That's one thing I think I've been doing for the last 10 years. But other than that, I know a couple of the ladies here who are starting businesses and starting churches, and my friend. And I think, my job would be to do whatever I can to be supportive of their endeavors.
And that's really great. Thank you so much for your
You're
time
welcome,
and for your
Pauline.
interview.
All right.